Hi, I'm Thanos Kristallis. I'm an oral maxillofacial prosthodontist here in San Diego. I'm part of UCSD, the Department of Head and Neck Surgery, Reconstructive Surgery, and Plastic Surgery. My background is in maxillofacial prosthodontics, and I'm cross-trained in implant surgery. We specialize in reconstructive head and neck cancer patients, and at the same time, we focus on guided surgery. So today we're going to be taking you through the whole digital workflow. So we're going to go through the digital data acquisition. So we're going to do intraoral scan, the CBCT, DICOM files, and then we're going to go through the process of designing, and then how we manufacture actually the surgical guides, and then we're going to look at the actual surgery. The guided surgery protocol, the whole digital workflow starts with data capturing. So the first step is the intraoral scanner. I like to use the Prime Scan. I also have the 3Shape. The reason I use them is they are very fast. The resolution is really good. Basically, when we're looking at a patient, we need to capture the full arch. Even if we're doing replacing one tooth, we want to capture the whole upper arch, the whole lower arch, and the bite registration. Very critical are the areas where the teeth are missing. So we want to capture the soft tissue because we have to superimpose that information on the DICOM files. So we need to have understanding of the thickness of the gums, especially in guided and flapless procedures. So when we're taking the scan, we want to start with the occlusal surface. We're going to capture the whole occlusal surface coming around the arch, and then we're going to do the palatal or the lingual, and lastly, I like to take the buccal area. I do the same on the lower arch. You can retract naturally, or you can use an Optragate if you want to retract so you have good access. Another thing that's very important is that you don't have any light shining back to you because it's an optical scanner, so you're not going to be able to capture the detail that you want. And also you need to dry the mouth, so always be working in a dry field when you're capturing your images. The second and very important aspect of digital patient data capturing is the DICOM files. So we do a CBCT. With the CBCT, you have different fields of views. We want to capture a pretty large field of view, so practically our goal is always to capture the whole upper and lower arch and the point of interest. We're going to superimpose that information with the STL file. One technique that we use, very common, even if especially the patient has teeth, is we'll put cotton rolls between the teeth, so we want to have some separation of the upper and lower arch. What that does is when we export that information, the DICOM file and the STL files into our planning program, we're able to superimpose that information without having any artifacts. Very important that the patient does not move during the capturing of the CBCT. So once we've captured the STL file, which is the intraoral scanner, we need to export that file. You can zip the file. I like to use them uncompressed, so I will export the whole file as it is. When it comes to DICOM files, you have several options. You have a single DICOM file or multiple DICOM files. You want to just export a single DICOM file, and usually you want to zip the file because the information of the 3D is enormous and you don't need all that information. So the STL file goes unzipped, but you have to zip and compress the information to reduce the size of the file when it comes to DICOM files. We export that to Dashboard from SprintRay, which just introduced their design, and you can use that and outsource it. Now that we've captured all the DICOM files and the digital data, we're going to move on to the treatment planning phase. So our next phase is the treatment planning phase, submission of all the information. So we use Cloud Design. So when you go to Cloud Design, you're going to go ahead and put the patient's first name, last name, the information. Then it's going to prompt you to put your STL files. So you'll put your upper STL file. You can import your lower STL file, and then a bite registration, which is not really necessary. Next, you have to put the DICOM files. And if you want to annotate any other information that the designer has to take into consideration, you can do that also. After that, you can submit the information. I really like Cloud Design because it's seamless, it's really fast. All you have to do is just go through the process of uploading your STL files and the information, the implant information too, obviously, and manufacturing and length and diameter of the implant. You don't have to worry after that. In 48 hours, you can get a design back. So you're going to receive a video. You can go through it, and the video pretty much explains the whole process of designing the implant size, and what the designer saw. If you like what you see, and this is really great feedback because it takes you kind of through the process of the treatment planning, and you can like virtually start thinking of how you're going to perform the surgery yourself. So once you approve the design is sent straight to your printer. So you don't have to go and use a third-party software. At that point, all you have to really do is press print. The base, the design, support, everything is done for you already. So even if you're a dentist that are doing this for the first time, or you don't have the experience to do this, it's really intuitive, and all you have to do is press print. Obviously, you can delegate this to your staff because it's really easy and a great process. Now that we're finished with the design, we want to move into the printing process. "3D printing is a really disruptive technology. Basically, when we look at 3D printing overall, we're looking at the fourth industrial revolution. At the same time, 3D printing is very accurate. So I can create a surgical guide that's going to be accurate, precise, and very minimal invasive. That's the way that we go with guided surgery. So once we're ready to print, we're going to go ahead and inspect our building plate. We want to remove it, make sure it's clean, and put it back. And then we're going to go ahead and mix the resin. And once we're ready and we've done that, we're just going to be pressing print. The print process will take about 45 minutes. So the benefits overall for 3D printing, first of all, there's cost benefits, okay? 3D printing, as opposed to outsourcing or any other manufacturing modality, is much cheaper. You pretty much have to worry about the resin, so it's a fraction of the cost that you're using. Time savings is enormous. 3D printing can be, as I said, you can go from digital capturing straight to processing and manufacturing, so you save a lot of time, especially if you're outsourcing to cloud design. You're saving a lot of chairside time, and that means less expenses for the dentist. Thirdly, and most importantly, it's value and quality care for the patient. So when we want to be treating the patient, we're thinking about customizing the treatment. The value that 3D printing brings to the quality of care, delivery of care, and the patient experience is enormous. So now that our print is done, we're going to go ahead and remove our building plate. We're going to inspect our print, make sure that it looks okay, and then we're going to put it directly into the Pro Wash. The Pro Wash is going to do a 2-stage cleaning and removing all the monomers and uncured resin, and secondly, it's going to do a fine cleaning. So Pro Wash makes it really easy for you to just go through the cleaning and drying process. After your surgical guide is done washing, we're going to go ahead and put the guide sleeves. Guide sleeves are depending on what kind of implant company you're going to use, and then we're going to go ahead and procure our surgical guide. The procure process will take about 15 minutes. So once the surgical guide is processed, the procure is complete, we're going to go ahead on the bench and clip all the supports. We're going to polish everything off. I use brass rollers, denture kit, polish everything, make sure that everything is smooth. Once we've polished our surgical guide, we're going to go ahead and bag it. We're going to put it in our autoclave. The autoclave typically will run for about 20 minutes at 260 degrees Fahrenheit, so heat and pressure are going to sterilize it. It's safe to sterilize it, and you want to do that before you do the actual surgery. Depending on the implant system that you're using, your protocol, your drilling process might include keys, as we'll see today in tooth number 14, or sleeves, fully guided system, as we'll see in the case of tooth number 30. Now that we're finished with the autoclaving, we're going to go ahead and move on to our implant surgery. Starting the surgery, first, of course, we're going to go ahead and numb the patient. We use local anesthetic, especially if we've got a single tooth that is missing. A very important step is you actually want to make sure that your guide is fitting clinically. So you want to go ahead and check that. What you're going to check is you're going to look through the windows that you've created in your design, make sure that everything is seated. After that, you're going to go through your normal guided surgery, the drill sequence that you've designed depending on your implant system, and go ahead and place your guide. We'll be demonstrating today a case where we already have fabricated the abutment and the final crown. You can print the final crowns, and that's something that we're really focusing on. The reason is speed again and accuracy. And if you're doing immediate cases, immediate load cases, or immediate placement cases, 3D printing really helps you in this process. And obviously, Sprint Ray helps us a lot in delivering this kind of care to our patients. So once you've placed your implant, you want to look at primary stability. So there's two ways to test the stability of the implant. One is insertion torque. So if you have insertion torque at least 35 and above, that's stable enough. The other way to go is checking an ISQ Ostel level of about 70. That's going to indicate that you can immediately load your implant. Obviously, you're immediately provisionalizing your case, but you're taking the case out of occlusion. Today, our patient underwent 2 different surgical procedures. We did guided implant surgery on the bottom. We did a fully guided protocol, so he had the implant placed, the abutment, and the crown at the same time. On the upper, we did a semi-guided procedure using the guide, and we used only a healing abutment. So 5 years ago, we would not be able, without 3D printing, to do a non-flappist procedure. We're saving time, it's a non-invasive procedure, and we are placing the implants much more accurately and precise every time. Our patient was very nervous in the beginning. The whole procedure took about 1 hour, and I think at the end he was pleased that the whole procedure was so easy. Now your patients are going to go out and talk about the positive experience, and this is a great business builder for your practice. So I want to personally thank you for joining us today. We took you through placing 2 implants. Everything went really good for the patient, saved us a lot of time. I hope that this experience will make you guys take the next step in digital dentistry with Sprint Ray.